Good morning, everybody. Welcome to today's webinar. My name is Ambra from PatientNOW's Denver, Colorado office. I'm just going to give everyone a couple more minutes to get logged in, and then we'll get started. All right, everyone. Looks like we have the majority of registered clients on the call. After today's training, there will be a 15-minute window open for questions on today's topic. Just go ahead and submit all of your questions in the chat room, and I'll answer them in the order received after the webinar portion of today's call. Again, if you enjoyed today's training, please submit a review on Google or submit a review to training@patientnow.com. Thank you and welcome. Today's webinar is going to be covering clinical information or the electronic medical portion of a patient's record within PatientNOW. There's 3 ways to access the clinical portion of a patient's chart. The first way is by right-clicking on a scheduled appointment. In your right-click drop-down menu, you'll have an option that says Select Patient Current Medical. This will take you directly into the patient's current medical section of their chart. The second way to access the current medical is going to be using your favorites. You can set up your favorites or configure them to have the patient clinical information section located in the dropdown. And the third way to get into the patient's current medical is by clicking on the patient's bar on the left-hand side and selecting the clinical information section on the left-hand side of your screen. Within the clinical information section at the top of the screen, you're going to see a lot of different tabs. For practices that don't need to utilize all of these tabs, for example, medical spas that don't need to utilize the surgery, lipo, or implant tabs, you can right-click on the top of your screen, select Show and Hide tabs. This is going to allow you to turn off or hide tabs that you do not currently use. For example, if we didn't need surgeries, lipo, or implants, I could uncheck those 3 boxes and click OK. You can also rearrange your tabs. So for example, if you do a lot of injectable treatments and you wanted that tab to be first, we could move that tab up to the top and rearrange the order. The first tab that we're going to talk about today is Current Medical. Current Medical is going to be where your patient's chief complaints, diagnoses, allergies, medications, vital signs, and immunization or injections are housed. Each of these sections has a green plus sign in the upper left-hand corner that allows you to add into the section. To add into each of these sections, simply click the green plus sign, which will pull up an add window. From here, you can choose what you're looking for, the size. If you don't see the correct size or location, you can click the green plus sign on the right, which will allow you to put in a size. And then location. Click OK to add. The only two areas within this tab that can't be auto-populated from the portal are chief complaints and problem diagnoses. The other 4 tabs can be populated from the portal when your patients go on to fill out their demographics, and that includes patient allergies, medications, vital signs, and if you want to track immunizations and injections, that can also come from the portal. The practice will need to document chief complaints and also the diagnoses. To add a diagnosis, you'll just click the green plus sign like I did for the chief complaints, which will pull up the Add Diagnosis window. Within the Add Diagnosis window, you can utilize your quick picks or shortcuts to pull up codes that you've already saved, or you can utilize the right side of the screen here to search for codes. You can also search by term, although searching by code is faster. Select your code, and then you'll click OK to save this to the chart. The next tab on the top that we're going to talk about is medical history. Medical history can all be filled out by your patients on the portal. However, in the event that your patient does not fill out the portal completely, or maybe they don't have an email address, your staff can come in here and manually add into each of these sections. This section includes medical history for active or inactive medical conditions, family medical history, social medical history, previous hospitalizations, and previous or past surgical history. If you need to add into each of these sections all together, there is also an Add All button in the upper right-hand corner. Clicking the Add All button allows you to add into each of these sections at the same time. So you'll see that you have the 5 different tabs on the left, and you can add into these tabs on the right. For example, if I needed to add a medical history of anemia, and maybe it's no longer active, I can uncheck the active button and click OK. You can see here under the medical history portion of the chart that anemia was added, but you're going to see that it's grayed out because it was a past condition. It's no longer active. Same thing for medical history. You can just select the family history tab, select the history that you're documenting, the relationship, and any comments, and click OK to add. Notice when I added that family medical history of breast cancer, it automatically inactivated the none indicated under family history on June 3rd of 16. Social history is added 1 question at a time. All you have to do is grab the question, select your detail, and type in comments and click OK. All of your medical, family, and social history descriptions are able to be edited. You can edit these or modify the lists in Administration, Clinical Admin. Same thing for hospitalizations and past surgicals. All you have to do is click on that on the left and enter in the type of facility, facility name, address, date, zip code, etc., and click OK to save to your patient's chart. To exit out of the Add All window, you can click the X in the upper right-hand corner. The next tab we're going to talk about is injectables. The injectables tab is where you can come to document or chart an injectable treatment. To document an injectable treatment, you can click the Add sign on the upper right-hand corner of your screen, which will pull up your Add Injectable window. Choose your date of service, and the injectable type that and the injectable type that we're documenting on. For today's training, we're going to select Botox and click OK. The first thing you'll want to do when charting an injectable treatment is document your lot number with expiration. You can click the Add button, type in your lot number, choose your expiration date. If you're using a dilution, you can type that in here and click OK. At the bottom of your screen, you are able to manually add in injection sites by clicking the Add button, typing in which injection site, how many units you injected in that location, and select the lot number and click OK. That is not the most common or popular way to document an injection in this screen. The most popular way to document an injection is, instead of utilizing the Add button, you can actually come over to your image. And at the top of your image, you're going to be noticing several different tools up on the top. The middle tool that looks like an A, if you hover over it, it says Place Text on Image. This allows you to automatically add injection sites while marking up on your image. For example, if I were to click on the A and then let's say I injected 4 units here into the glabella, I can click OK. It's going to put a 4 on my image as well as document the second injection site here with 4 units and automatically pull in the lot number. So you can see how this would be a little bit more efficient with time, since you can just click, hit OK, and then move around the injection sites. The tools on the top of the screen here, I'll just go over all of these. So the first one is going to be a free draw. So all you have to do is select the color and the point of the pen that you'd like, and you can draw on your image. The second one is going to be a highlighter. So you can choose thin, medium, or thick. And from there, you can also choose your color. So if you wanted to organize your image by color, you can just click on the color wheel, choose the color that you'd like to utilize, click OK, and then from there, you can mark up your image. The hand tool allows you to place sequential numbers on your image. So if you had manually documented your injection sites here and you just wanted to mark them on the image, we could say 1, 2, 3, 4. And notice that they pulled in green. So you're able to change the color of all of the different markups on your image. So if I wanted to go back to black being my color, I could just choose black, click OK, and we'll just continue on counting in black. The pointer finger allows you to place an X on your image. So for example, if we were charting on a filler, and let's say you just wanted to document where you injected 1 cc of filler, I could just place X's where I injected the patient. The next tab that we're going to talk about is the Laser Treatments tab. The Laser Treatments tab is basically the same as the Injectables tab, except for you're documenting a laser treatment. On the right-hand side of our screen, we're going to click the Add button, which is going to ask us for the date and time, the provider who performed this procedure, the type of treatment that we had, were there photos taken, yes or no, patient's skin type, Fitzpatrick, and click OK. Now, one thing that you are able to do in these screens that we didn't talk about in the Injectables tab is on your toolbar, there is an image library or clipboard. If you needed to update your image, for example, let's say that Patty had laser hair removal on her upper lip today, so we needed a face image. I can click on my image library tool, and from here I can choose an image from my image library. So I can go to the face images, and I can choose from all of the various images that are here in my library, and it's just thinking. So if I wanted to choose my Exilus face or the Allergan face, I can just click select, and it's going to pull in that image. Now within the Laser Treatments tab, you do need to manually come down to the bottom, click the Add button, which will ask you to document your laser treatment area. You can fill out the settings, choose your spot size, enter in pulses, was there eyewear worn, any arrhythmia, discomfort level, complications, comments, follow-up, and click OK. And then on the left, you can mark up your image. So for example, if we were documenting that we did laser hair on the upper lip, we could just chart on it like that. Everything in the Injectables tab and the Laser Treatments tab automatically saves, so there is no need to click Save. Once you're finished documenting on your images, you can go into Document Creation, which we'll be going over in the next webinar, and it'll automatically pull these onto your notes. The next tab we're going to talk about is the Aesthetics tab. Within the Aesthetics tab, you're able to document facials, microderm, peels, and waxing. Most practices that utilize or chart on aesthetic treatments like this utilize the esthetician note that we already have preloaded for practices. However, if you wanted to do additional charting in this section, you can. All you have to do is come to the right and click Add on the appropriate section that you're documenting in. The next tab we're going to talk about is surgeries. The surgeries tab is where you can chart on a surgery that a patient is going to be having. There are a couple of ways to add a surgery into this tab. The most popular way is going to be from the schedule. And the reason I like documenting a surgery from the schedule is it will automatically pull in the scheduled date, the duration of the surgery you scheduled, the surgeon who's going to be performing the surgery, and the facility where the patient is going to be receiving the surgery. You can, however, also add a surgery from this screen here by clicking the Add Surgery button on the lower left-hand corner. When you document a surgery in this screen, it does not automatically pull in date, duration, reason, or facility for you, so you will have to manually do this yourself. So we'll just say Patty Test, let's say she's getting a surgery on October 17th at, let's just say 6 a.m., and let's say it's going to take 2 hours. Maybe the reason is a breast augmentation. You can select diagnoses if you've already documented them. If you need to add a diagnosis or CPT code, you can click the Select button, which will pull up your Add window for the code. If you add codes from these windows in the surgery screen, it will automatically populate those codes into the current medical and procedure tabs. You can also select your surgical facility, your surgeon name, if you're using an anesthesiologist, the type of anesthesia. If you have a surgical assistant, you can select that here. You can also attach a coordinator, a provider that referred your patient, and enter in additional comments and click OK. The next tab is lipo measurements. This is where you can document pre-op and post-op measurements for lipo patients. To add a measurement, click on the Add Measurement button on the top for pre-op or on the bottom of the screen for post-op. Both of these Add Measurement windows will allow you to document within centimeters, arm, breast, chest, etc., thigh, knee, calf, ankle. You can document sizes for all of your patients here. Click OK to save. The next tab is going to be implants. Practices are able to track their implant lot and serial numbers for their patients. In order to do so, you do need to have your implants loaded into your inventory. To add an implant to a patient's chart, you can click the Add Implant button on the lower left corner of your screen. Select the date of surgery, the surgeon. If it's bilateral, left and right, if you're doing cheek or chin, you can select that as well. The manufacturer. You can select the product that you're utilizing. So if we were doing a silicone, you can type in the style, catalog number, lot number, serial number for left, serial number for right, whether or not it was implanted, the fill volume, and comments, and click OK. The next tab is Procedures. Procedures tab is solely used for CPT codes or procedure codes. For practices that are utilizing the insurance module of PatientNOW, you're likely very familiar with this tab. You are able to add procedures directly into an invoice, or you can add them into this tab here. If your providers are adding in the CPT codes prior to the insurance invoice being created, you can allow for CPT codes to automatically be pulled into your invoices. To add a CPT code into this screen, you can click Add Procedure on the lower left corner, which will pull up your Add Procedure window. You can utilize your quick picks or favorites within this screen by selecting the category they're associated with and selecting that code. You can also use the search engine. Let's just do it 99213. You can type in your code and it'll pull in your CPT code down below. If you click on a box, it is going to pull up the option for modifiers down below your CPT code as well if you need them. Click OK to add your code. The next tab is massages. If your practice offers massages, you do have the ability to track or chart massages here in this window. To add a massage, you can click Add Massage on the lower left-hand corner. You can choose any of the areas of focus, the massage type, if there was aromatherapy, musical preference, comments, and click OK to add. Tissue expanders is the next tab. Tissue expanders are for surgical practices only. To add or document a tissue expander, you can click the Add button on the upper right corner, which is going to pull up your Add Tissue Expander. This also needs to be added into your inventory if you're going to be tracking the lot and serial numbers. You will select your manufacturer, the product, and I don't currently have any tissue expanders loaded, but your product would pull up here. You can document your style, volume, catalog, lot, serial numbers, and click OK to save. The next tab is going to be clinical summaries. Clinical summaries allow you to send your patient records to the portal or print out a patient record for your patient. It's important to notate that it only sends information from clinical information. When you're sending clinical summaries, your encounter notes that the doctor writes up, they do not get attached. It also does not send any patient communications. It is literally only the patient's medical history, current medical, aesthetic treatment, surgeries, and products used and care plan. Nothing else goes, including injectable and laser treatments. Those also do not go. To send an appointment or clinical information to your patient, all you have to do is select the appointment that they're looking for, choose the sections of their chart that you would like to send. If you would like to send everything, there is a Select All button on the top. And from there, you can either file this in their record, send it to the portal, or you can print it out for the patient. If you see that the portal is grayed out here, that means that the patient is either not consented, not signed up, or they don't have a valid email in their chart. Second to last tab is Products Used. Products Used is a catch-all tab. Anytime a patient comes into your practice and purchases a product, it's going to automatically document in this tab. That way, if the patient comes in, let's say in 8 months, 9 months, a year, and they mention a product that they had purchased last year and they wanted to buy it again, you could come in here, glance at when they were last seen, what product they purchased, and let them know if you still have it on hand or not. The last tab is the Care Plan tab. This is an additional area where you can put in notes for patients. It's most commonly used if you are going to be sending those clinical summaries to the patient's portal. You can type in instructions in the middle of this screen here. So if you wanted to send clinical instructions, document something from the care team, or document cognitive and functioning status and send it over to the patient, all you have to do to add into these sections is click the green plus sign, type in, click OK. That is everything on the clinical information section of PatientNOW. I am now going to open up the webinar for questions. Next webinar is going to be on October 2nd, and we'll be covering the document creation portion of the patient's medical chart, which is going to be documenting the encounter notes. So definitely make sure you come in for that one. I'm going to go ahead and open up the questions. I'll give everyone a few minutes to submit them. Okay, good question. So Melanie asked, can you add medications that are not found in the preloaded list? So this is a question that I get a lot. And the reason that we have a preloaded list in the patient's current medical is for our drug-drug allergy interaction. So for any clients who are using our electronic prescription writer, you'll notice that you get drug-drug allergy interaction warnings. And so this medication list here within PatientNOW ties into the prescription module. And so in order for that drug-drug allergy interaction check to work, we have to be able to talk to it. So if you have a medication that is not found in the preloaded list, I typically recommend that you just look up the medication base ingredient or the main ingredient in that medication and document it there. You can always put in comments if you need to. And you can always search for obsolete drugs. But our list does pull from New Crop site, and they only allow for drugs that have an active NDC code. So if the medication that you're looking for is not available in the United States, or if it doesn't have a current NDC code, you're not going to be able to find it in there. So search for the main ingredient. There is a contains option here, so you can search for the main ingredient. Okay, another question. I'm finding patients that are on medical marijuana in their medications, and I don't know how to add it under meds. That is an excellent question. Medical marijuana is not federally recognized, so it's not going to pull up in that list. You know, I would recommend putting it either in a note or maybe documenting it with another medication in comments. That's a tricky one though, because it's not federally recognized. You could also manually type it into the notes, which I know isn't super helpful, but you could always try to put it into social history as well, and just make sure that you're checking that section of the chart. Another question, when you're adding a past surgical history, what if they don't have a date? Good question. If they don't have a date, you could try to put in, you know, generally to see, you know, maybe put in, you know, if it was 2 years ago, but they don't know exactly the date, put in January 1st or something like that, just so you have a good estimate. Typically, they'll at least have an idea of when they had their surgery. Next question. Where should you put social history, workplace, profession, and hobbies so it appears in current medical or in an encounter note? If you would like to add those, you can add them to the social history. Social history questions pull up in the medical history tab under the social history section here. If you want to add more social history questions, you just need to go on the lower left corner to administration. And from there, you're going to go into clinical admin. And within clinical admin, your social history questions are going to be at the bottom of your screen. And to add a social history question, you can just click the green plus sign here at the bottom of your screen. If you don't have access to this or you don't see that section, you may need to go to an administrator to help you. But you can click the green plus sign, type in the description of your question. Now, it is important to know that when you have a social history description, these are one answer only questions. So you can't put in, please select all that apply, or please check the products that you're currently using. They can only select one thing. So for example, you could say, are you using Accutane? Yes or no. For example, I already have a question here. Are you on a special diet? Yes or no. They can't say, you know, please select all that you eat, etc. Okay. All right. Any other questions on clinical information? Looks like that was it for questions, guys. If you need anything else, please feel free to email your trainer, or you can shoot over an email to training@patientnow.com. Again, our next webinar will be October 2nd, covering document creation. Thank you all so much for joining, and we'll talk with you soon. Have a great day.